Well, hello, everybody. Glad you're here. This is Zeki Hamid. I'm the Director of Community Engagement at KUOW, and welcome to the 12th episode of Are We Going to Be Okay? Now, if you haven't joined us before, this series started out as a way to give community members a virtual place to come together and feel like a community again because of COVID-19 and our inability to gather in person. At the same time, we wanted to check in with communities and industries that make up our region to see, how we're doing and to get tips and tactics about getting through this pandemic together. But the title of this series, Are We Going to Be Okay, has taken a very different meaning in the past couple of months because of protests against police violence and for racial justice. This show has covered a whole lot of stuff, but at the heart of it, it's always been about checking in on our own and how we're doing as a collective. So this is what this is all about, and this episode in particular is about public health. But before we get into it, I'd like to introduce my co-host for this series, special projects editor and co-host of the podcast Battle Tactics for Your Sexist Workplace, my friend Jeannie Andol. Hey, Jeannie, how you doing?
Hi, Zeki. I'm doing okay. And as you mentioned, this episode is about public health. It's about healthcare. I feel like I should just say I'm going to really understate things, but there is a lot to talk about on this episode. We have lots of things that we can discuss. How we've seen public health and healthcare become even more politicized during the course of this pandemic, how we've seen this pandemic disproportionately affect Native communities, Black communities, and just overall access to healthcare. There are lots of different things we can talk about, how overall access to healthcare plays into this pandemic. And before we get started with all of that, I want to do a little housekeeping for everybody who's watching. You're going to notice Zeki and I looking down a lot, and it's because we are checking our notes to make sure that we are including questions and comments from you. Our producer is sending in your questions, your comments, so we can include those in this discussion. And you can drop those comments, those questions below wherever you're watching, on YouTube, on Facebook. You can also text OK to 206-926-9955. Any platform that works for you works for us. On every
Sounds good.
episode of the show, what we try and do is talk about strategies and tactics for getting through, I feel like this should all be capitalized, these uncertain times. We will be doing that today, but we're also going to talk about how to think critically about what we hear about this pandemic, what we hear about protests, and also how we can continue to take care of ourselves and each other as this moves into month 6 of this pandemic.
All right. Let's introduce our guest, shall we?
Yes.
That sounds good. Our guest today is Abigail Echohawk, who is an enrolled member of the Pawnee Nation of Oklahoma. She is the Chief Research Officer for the Seattle Indian Health Board. She also serves as the Director of the Urban Indian Health Institute, a tribal epidemiology center. I always have trouble with that word, whose mission is to support the health and well-being of the urban Indian communities through information, scientific inquiry, and technology. Abigail, we're so glad you're here with us today. Thank you so much for joining us on the show.
Really excited to be here. Great with saying epidemiology. I feel like for the very first time in my career ever, over the last couple of months, I hear people everywhere saying epidemiology. And before,
Right?
every time I say my job, they'd be like, and what do you do? So
No explanation needed now.
For once, I don't have to answer that question. People have some kind of idea and they're actually saying the word. So congratulations on getting it right.
Thank you.
That's amazing. So I wanted to start off, Abigail, by just sort of, I guess we're going to travel back in time a little bit to January. And I wanted to do that because I can remember on Twitter and elsewhere reading stuff from doctors, from epidemiologists, talking from public health officials, kind of talking about the coming storm of this pandemic. One of the big things that kept coming up was deep concern over how unprepared our healthcare system was for something this massive. Do you remember in January what you were thinking when you first started hearing about COVID-19 and its potential arrival in the United States?
Yeah, as an Indigenous public health practitioner, so greetings to everybody from the lands of the Coast Salish people here in Seattle, Washington, where I'm sitting in my office at the Seattle Indian Health Board, a federally qualified health center here in Seattle, where we serve American Indians and Alaska Natives. About 70% of our population almost is American Indian, Alaska Native, but we serve everybody who comes to our clinic in the Native way. So I was sitting in our clinic, which is funded by the Indian Health Service, and also as a federally qualified health center, we do get funding from the federal government. Chronically underfunded health center, as many federally qualified health centers are. And in January, as I began to see as a public health professional, I started getting all of these news alerts. I started getting all of these emails from folks from across the country, and I started to feel some panic. My responsibilities as the director of the Urban Indian Health Institute is both local here for the Seattle Urban Indian community, but also national for the 71% of American Indians and Alaska Natives living off reservation lands in urban settings. My responsibility is to those people. And as I began to receive this, as I began to investigate what was going on, looking what was happening in China, I felt that panic because for many years, public health practitioners like myself have been consistently advocating at the local, at the state, and the federal level for the fact that our public health systems are so drastically underfunded that we were not prepared as a country to address what was going to be this ensuing pandemic. And so in January, my team and I started to get ready. And as I started to get ready and pull together the resources we had, our biggest resources was people power, time, because the actual physical resources of the public health aspects that we needed, the monetary resources, simply weren't there. And so I'm looking back at January, I kind of look back at weeks of sleepless nights, I remember, of thinking about how we were going to ensure that when we come out of this pandemic, that my people, Indigenous people, and other people of color, that the disproportionate impact that I saw coming in my heart, I was just thinking, I cannot watch all of these people die. And what are we going to do to ensure that doesn't happen?
So you said, when our producer, Zaytun, when she called you and to kind of go through some of these topics with you, and she sent me the notes, and one note to me kind of stuck out, and I want to kind of get your, if you can expand a little bit on that. You said that the impact of COVID-19 on Indigenous communities is not an accident. So I was wondering if you can just tell us what you mean by that.
Yeah, absolutely. So as we look at the data that is currently available on the impacts of COVID-19, so we're talking about mortality, the deaths of our elders, of our youth, of our children, and also just the incidence of the infection in communities and Indigenous communities nationwide and here locally, we are seeing a disproportionate impact. There's actually going to be a paper coming out in the CDC tomorrow that I was part of writing, that's going to show the disproportionate impact on American Indians, Alaska Native, as compared to the white population. And so we look at that, and we also see that across other communities of color. The Black community here in Seattle has been deeply impacted. That isn't an accident. Why is it that we are at higher risk? We are not at higher risk because I'm a Native woman. My cultural background does not put me at higher risk. Being a Native woman living in the United States in a system that has impacted our health through the continuing colonization and institutional structural racism that has created health disparities such as asthma, cardiovascular disease, things like high blood pressure, cancer, diabetes. Our people suffer from these as a result of the ongoing colonialism that is existing in this country, the continuing oppression and suppression of our economic vitality as Indigenous people and as people of color. And so when COVID-19 came, you'll see all the things I just named are the underlying risk factors for mortality, for deep impacts of getting put in the hospital and ICU and on ventilators. We have the highest rates of those risk factors as a result of these underfunded colonial systems that have been working to eliminate us, truthfully, and have continued to suppress our ability to reach healthy, full lives. Now, with a pandemic like COVID-19, it created the optimal environment to kill us. And so that is what Indigenous people across the nation are fighting right now. That's what we're doing at the Seattle Indian Health Board right now, what other Indigenous organizations are doing. I've been thinking a lot. You mentioned the what are called as the protesters. I call them justice seekers. For the justice seekers who have been on the streets fighting and calling for justice in a multitude of different ways, those streets are not new to us. We have been doing that, and often it just hasn't been heard. And so now we're seeing that disproportionate impact, and we are seeing our people suffer, and we're doing everything we can to minimize that suffering. But we have to make some change in this country. Like, we have to change. We can't go back to whatever people are like, I can't wait to get back to normal. Like, y'all's normal was never good for me. Y'all's normal harmed me, harmed my people, harmed my children, harmed my relatives. So I'm looking forward to getting back to a new normal that is based in equitable practices, that is looking to eliminate the burden of disease and viruses like COVID-19 in our communities, because we can't allow this optimal environment for the death of my community to continue. It's almost, like, is this the continuation of genocide against Indigenous peoples? People like me think so.
You're really raising some really important aspects here. And I do have a couple of questions, though. I guess one of them is, COVID-19 took a lot of communities and cities by surprise. And to hear you talk about, the underfunding, which we will get to in a little bit more detail in just a bit. But I'm wondering, like, some communities were just more prepared than others, really globally. So I'm wondering, how were the indigenous communities in Washington prepared? Does this took them completely by surprise? Or were you just a little bit more prepared for something at that size?
One of the great things about the tribal communities here in Washington State is that many of them had emergency preparation plans available and ready to launch. And so there's also support from my organization, along with other organizations, such as there's a Commission on American Indian Alaska Native Health. And we came together as a community and began to make and provide resources and make decisions. So you saw tribes like the Makah Nation, like the Nisqually tribe, like others, who actually cut off all access to their reservations to anybody outside of their community. And so as a result of that, they were able to protect their communities and make decisions as sovereign governments in a way that other communities weren't. And so our communities really stepped in and did what they could. However, while our tribal leadership made those great decisions, they didn't have all the resources that they need. And that is because, again, of the chronic underfunding of not only the public health systems, but the Indian Health Service programs that provide healthcare on Native reservations and here in urban areas in the cities. And so there was limited access to tests. There was limited access to getting those tests to the labs. So it wasn't the system we wanted, but we did the best with what we had. And I actually think that some of the moves that were made by tribal leadership were the basis, I believe, of like some of the decisions that Washington State made, that other counties made, because the tribal people stepped up immediately and began to make decisions for their people. And they listened to those in the communities like myself who have the experience and have been preparing our whole careers for something like this. They listened to us. And we need more of that across this country. Listen to your public health practitioners and put your mask on.
So we want to talk about, you've pointed out more than once that one of the big issues here is chronic underfunding, not only of public health in general, but also of access to healthcare for Native communities. But you said something really intriguing. You think that some of the decisions tribal leaders made were then looked at by Washington State, government, and then decisions were made based off of those. What do you mean by that?
I really think that we have always led by example, and Washington State is one of the few. And I do work nationally, and I know that not all states have good relationships with their tribal communities. Washington State does, and we have a good relationship. There's a tribal liaison within the Department of Health. We have a good relationship with the Secretary of Health. And as tribes begin to make decisions for the good and well-being of their people, we also, we have these like weekly and monthly calls with the state of Washington and sharing those best practices. And the folks in Washington State at both the state level and the local levels have really been using examples. And I personally believe that they saw some of the examples being done in tribal communities and use those to help create some of the decisions. There's a lot that can be learned from our tribal communities here locally and nationally. I always feel like, don't come to us because you think we have all the problems. Come to us because we have a lot of the answers that we want to share and bring to the larger communities that we live in.
So let's talk about public health policy. Let's talk about funding. The most exciting 4 words ever said. Let's talk about funding. But we'll start with policy first, I guess. You know, not that you can extricate policy from funding, really. But what do you think this pandemic has exposed or, you know, made more plain when it comes to public health policy, what works and what doesn't?
Yeah, you know, it really showed and highlighted where the big gaps were. We can have policies related to have an emergency preparedness plan. Make sure that that plan is spelled out. Make sure you know how to deploy public health professionals to go investigate, you know, virus outbreaks, et cetera. And we had those, and we had some pretty good ones. But if you don't have the resources, if you haven't trained the people, it takes a long time to pull all that together to be able to deploy it. And that's what we saw. Washington State was actually ahead of some other states because we had invested in the last legislative sessions. There was some investment in what they called foundational public health dollars. It was not what we had hoped for, but it was some public health dollars that other states didn't have. And my organization had received some of those to work with the urban Indian community. And the moment this pandemic emerged, we shifted. We were able to move and we were able to use those funds, even minimal as they were, to address the needs of the urban Indian community in Washington State. And that's not the same for all states. So we were a little bit ahead, not by much. And it's really highlighted what those gaps are. Yeah, for example, so because I serve the urban Indian community nationwide, it's 71% of our overall population. I work with more than 60 clinics across the nation. In early February, the CDC, I'm a tribal public health authority. That means the CDC, the states are supposed to treat my organization like they do King County Public Health. So Director Patty Hayes and I are sort of supposed to be parallel in that sense. So I reached out to the CDC and I asked them that we needed to do a webinar. We needed to train, we needed to bring forward what was happening with this pandemic and start putting together the precautionary measures for our clinics. So we reached out to the CDC and we waited for another week. And so we emailed again, and then we emailed again, and we emailed again. We don't hear from them about this until the end of March. And by then, we're full on in a pandemic. And I still don't know why that happened. It's not what's supposed to happen. Were they in the midst of their response? Probably. Was there not enough people to respond to all the public health requests? Probably. Right. But what could have happened if I had actually been able to get more of that? And I did the best that I could. We could have done better. What if I had actually been able to get those resources from the Center for Disease Control to these clinics nationwide and here locally in Washington State? What I always have the what if, right. But getting 2 months from them to do a basics 101 on COVID-19 and how to protect your clinicians and how to do the test properly, you know, by then it was too late.
Yeah. Well, let's talk a little bit about what investment looks like then. You know, and you just gave a really clear example of a chain of events that could have been caused by underinvestment, by underfunding, right? Lack of staffing, ability to only deal with sort of, you know, one thing at a time at the CDC level. It's generous of you to assume that it was because of underfunding. But we talked with a couple of people at the UW School of Public Health about underfunding, what that might look like. And Professor Betty Beckmeyer gave us a couple of good examples, such as just old data systems, old technology, like one system can't talk to another system, which means there are all these cracks that information falls through, that patients fall through. Local health departments that are really thinly staffed, and they become very quickly overwhelmed with everything from, you know, contact tracing efforts to just sort of basic healthcare during a pandemic, not enough resources to hire, coordinate, or train staff, not enough volunteers for contact tracing. I'm sure all of this is very familiar to you at this point. When you think about what underfunding a public health system, which sounds like very non-descriptive language, when you think about what that looks like, what example springs to mind for you?
Oh, so many. I mean, it's like in my head, I'm like, oh God, what do I start with? It's, I laugh because I don't know what else to do, because I'm going to start with an example. So Seattle Indian Health Board, this has been widely publicized, but we asked for PPE. We are running out of personal protection equipment for our staff. We're providing care for folks, testing folks for COVID-19, and our staff deserve to have the proper protection equipment in order to fulfill their jobs and to serve the community. So we sent out requests to both the state and to our federal partners at the Indian Health Service, requests for PPE. And several weeks later, we get our first box. Yay, excited, open our first box. And instead of finding masks, gowns, the things that we needed, we found it was a box of body bags. So they sent us a box of body bags before we got masks. And our first delivery, a substantial delivery of masks, came through a partnership with a local Native organization, 8th Generation. CEO is Louis Gong, a Nipsac tribal member, who connected us with his manufacturers in China in order for us to get masks. And so here we have the public health entities send us body bags when we as a community are the ones who step up and get us the personal protection equipment. And so when we think about this chronic underfunding, I want to be very clear. The chronic underfunding of the public health system is directly impacting and disproportionately impacting people of color. This system has been built to marginalize us. And so when we think about the data systems, for example, when we look at Washington State, we're missing so much data. So when they get the data and it says this person's tested positive for COVID-19, and they didn't capture their race or ethnicity. So when you see the data on who's being disproportionately impacted, know that that is a gross underreporting of it, because it is much higher numbers, but it's running between 20 to 30% of all COVID-19 tests don't have race and ethnicity attached. And then the systems, when it is attached, can't talk to each other and make comparisons. Who does that impact? People of color. It's not impacting the majority white population. And so we are looking at institutional systems that are embedded, they're structural, these data systems, how things are reported in them, what people are held accountable to. But because the impact is on people of color, as a result of the racism in this country, it's continuing, it's disproportionately impacting us, and nobody is acknowledging it to the extent that I really feel they need to. And when people of color are disproportionately impacted, it affects the entire health and well-being of our community, regardless of what race and ethnicity you are. So these underfunded systems, they're underfunded because in the policy world, in the funding world, and those who are making the decisions don't look like me, didn't come from my communities, don't represent us. And as a result, these ongoing systems continue to harm us. And so the underfunding of this, we need more Black, Brown, Indigenous, racial and ethnic groups, people from a variety of socioeconomic statuses to be public health professionals so that we can be part of changing the system. We need to invest in the collection of and ensuring that, right now they tell us they're making data-driven decisions. Their data is crap. If they can't make them, they should quit saying it, because they can't. And so we have to change these systems, because the people that are being affected, they are the ones experiencing the greatest harm. And as I think about those justice seekers on the streets, we need those justice seekers. We need those voices. We need those folks to be pushing, to be yelling, crying, and screaming, and pushing it into the faces of all of those who have not had to be in the space that I am, or have to acknowledge. And it's not that they meant to ignore it, it just wasn't their reality. And now they have to open themselves up to that reality.
This is a great kind of segue, actually, because we're getting some questions from viewers right now. And Doug from Facebook asks, does public health require a social justice approach?
Absolutely. So I always say I was born a public health practitioner. And that is because, public health from a Western standpoint is like the health and well-being of an entire population. Like, well, as a Native person, we never cared about just ourselves as individuals. we always took care of each other as a community.
Mhm.
And so public health from a Western perspective doesn't meet the definition in my community. And that is for many communities. I would say the same for the Black community, the Latinx community. And as a result of it being shaped on Western standards, public health often
Mm.
will have a discriminatory, unintentional consequences of marginalizing people of color. So as public health professionals, it is essential that we come from a race and social justice perspective, recognizing that we have to even undo the systems that public health has established, because part of what public health is doing is part of the institutional and structural racism in this country that marginalizes us. So great question, Doug from Facebook.
We got another question as well about communicating information, communicating data. And the question is, how are King County Public Health and other public health departments or organizations communicating with minorities about COVID? For example, are they translating documents widely?
So King County Public Health does a pretty good job. I have to give a lot of credit to Director Patty Hayes. We have a strong relationship with her team, and we work very closely with them, and we work to transmit that to our communities. I know they have those relationships across other communities of color, but what happens in King County isn't necessarily what's happening in Thurston County, for example. I don't know, I can't say specifically, but it varies county to county and state to state. And so one of the things that we do know is that, and what I'm always pushing the public health departments, both at the local level and also at the Washington state level, is often how they present the data is not done well.
Mhm.
They don't acknowledge the data that is missing, or they put in a little asterisk in the bottom, or they say, you know, the data on American Indians and Alaska Natives is statistically insignificant. So instead of saying the practices at the hospitals and clinics have not collected the correct data, resulting in an underreporting of American Indians and Alaska Natives. I would say every day this week, I've been told my community is insignificant. And so as we look at those microaggressions, as folks may call them, I think they're more than micro. We are in a battle to ensure that public health uses that equity and social justice lens to present, to work with communities, and to acknowledge they need to do better. We all need to do better. We can only continue to search to do better. And so they may be doing well in some communities, and they may not be doing well in other communities. And it takes strong public health leadership like Patty Hayes and others to acknowledge that and to find the best practices forward. Again, we need investment in the systems in order to do that.
Can I, before we move on, can I quickly
Sure.
ask you, what would that investment look like? I think I have an idea of what you're talking about, that for one thing, you need to
Mhm.
follow more closely what's happening in different communities when it comes to this pandemic. But tell me what it would look like to have an investment that is actually working for every community.
Well, an investment that's working for every community recognizes that one way isn't going to work for all communities. So what you need is a public health emergency plan that has flexibility for the unique needs of each individual community. So the needs of an American Indian Alaska Native community is very different than the needs of the African American community. There may be some commonalities, but it has to be flexible enough and provide enough funding in order for the communities to go and do what they need to do. I'll give you an example, contact tracing. So contact tracing, for folks who don't know, is if you have been exposed to COVID, you may get a call from somebody that says, hey, you know, you sat down at dinner with this person and now they've been diagnosed with COVID. And, you know, they go through and they try to find each person who may have been touched by that.
Mhm.
Now, my community is not going to answer a call from Washington State. Not a lot of trust in the state government,
Mhm.
not a lot of trust in the public health systems. Would they answer a call from the Seattle Indian Health Board? Yes. And so you have to look at, like, the individual communities need to have the flexibility and the funding to deploy these public health things such as contact tracing well within their communities. And building up that kind of infrastructure is not cheap. You have to train
Mhm.
people, you have to have space. If they're at home, you got to find a laptop somewhere, you know, all of the things that are needed. And we just haven't, you know, we have not seen that kind of investment at the federal level or at the state level. And it is necessary and it is needed, but it has to be flexible and built on the needs of the unique communities to reach the end goal, which is to halt this pandemic in this state and in this country.
That was such a great point about trust. I mean, that's something that we deal with in definitely in our profession, at KW, is establishing that kind of trust. And that's just a great point. For people out there, if you're watching right now live on YouTube or Facebook, you can just put on the questions. If you have any question for our guests, just put them right below in the comments. You could also text the word OK to 206-926-9955. But I do want to kind of jump right now to talk about politics for a little bit. COVID-19 has certainly been politicized, right? So both nationally and locally. I mean, a local example, you have the Lewis County Sheriff a little while ago, about a few weeks ago, maybe a month ago, that told residents not to be sheep in response to, what Governor Inslee, his coronavirus mask requirements, told them not to be sheep. And I'd have a kind of a hard time thinking that this would have been as politicized in previous administrations. Like, I would have a hard time thinking this would be as politicized in the Bush administration, for example. So my question is, like, how, or what have you seen from indigenous community and like in terms of the response to this politicization, and what do you make and what do you do to make sure that people are turning to science rather than politics on this?
Yeah, it's been really unfortunate to watch this. And actually, within the public health community, in the course of my career, I've never seen the impact of politics on public health folks in the way that it has. We've had folks across the nation and even here locally in Washington State who have been doxxed. So they're leading up public health entities, and they did things like everybody's required to wear a mask. And then folks who are unhappy with science that tells us that is the way to stop the spread of COVID, release their information of their homes, of their personal addresses on different mediums, and they were immediately viciously attacked and threatened. It's been quite a while in the work that I've done in public health where I've seen public health practitioners physically threatened with harm and their families threatened with harm because they are offering and mandating certain things like wearing a mask to ensure the safety and well-being of our community. And the current political environment in which this country is in is absolutely driving that. And so when we begin to hear policymakers and folks from the current administration talking about COVID-19 in a way that is not based in the science and instead drives this narrative of, that this is untrue and is some kind of, mass conspiracy to get everybody to tank the economy or whatever it is. There's so many theories. You could get a different one every day. We are finding that it's actually ending up in the lives of public health professionals being threatened. And folks resigning, good folks resigning from their jobs because they're afraid for their families. It's really hard to watch. There hasn't been as much of it within the indigenous communities. And I think there's a really specific reason why, is that we are and always have been public health professionals. Our tribal leadership, their entire purpose is to ensure the health and well-being of our communities. And so we find that within our tribal communities, they follow the leadership. When they say, we are all going to shelter in place, wear masks, and not allow anybody who's not a tribal member on the reservation because we want our elders to live, we say yes. So what we're seeing is the playing out of community values based in not individualism, but instead connectedness to each other. And the messaging that we see in our community, which is to stay physically distant, but remain socially close. And so again, I think there's a lot of lessons that could be learned from the tribal communities that, we know and understand what's happening in the community, and we are going to do everything to protect our people right now, because doing that protects our future generations.
This is great that you mentioned, the conspiracy theories. Actually, you kind of answered my next question, but I wanted to see if there's anything else you want to add to it, because, I was thinking about all of the conspiracy theories that are out there. And I was like, the question was, how do you make sure that the right information about the disease is getting to the people? And you definitely kind of, went down the road of answering that. I was wondering if there's anything you want to add to that, or anything specific.
Yeah, so I think I have a 19-year-old son. He's a lovely, lovely man child. Nobody tell him I called him that. Hopefully he's not watching. But, he knows what I do.
Sounds like a superhero, man
Exactly.
child.
What does that emblem look like,
Oh my gosh. A superhero who needs a lot of support from the people around him.
Exactly. So when I come home, he'll be like, Mom, you'll never guess what I just heard. And he'll tell me whatever's the newest conspiracy theory he has found in all his teenage social media. And we just like laugh hysterically about it. But he's like, there's people that believe this. He's like, what about people who can't talk to their mom who does this for a living? And that's a big concern. One of the things that we're trying to do in the public health community is recognizing that not everybody gets the same messages in the same ways. We need to ensure that they're relevant to the communities, that they're translated into the proper languages. And we also have to recognize that particularly, again, communities of color don't have the same access. So for example, in many tribal communities, there's no broadband. We're, for some tribal communities in the Southwest, all the messaging that was coming out from the state said, wash your hands, wash your hands. They don't have running water. So we have to adapt those messages to the communities that need them. And we have to find the modalities of what works to get them to them. So folks who don't have broadband, whose cell phones don't work in rural areas, we start using the postal service again. We've done that. That's happening across the nation. We have to use to reach the teenagers, the newest, like maybe I need a cool public health TikTok video. Maybe that's my next thing.
I want that. I want you to do that.
I kind of want to do it. Maybe my kid will appreciate me a little bit more. We have to adapt to what the communities need. And again, recognizing there's no one size fits all. And the messaging is so important, and it needs to come from trusted community sources. So, I can't send to my very rural Native community, my urban Indian community. I'm not going to send them a pamphlet or put together this cool public health messaging campaign with a whole bunch of white faces. It needs to be representative of the community. It needs to come from organizations like Seattle Indian Health Board, like the other ones we have here in the Seattle community that serve communities of color. We need to work with the communities and adapt the messaging to meet their needs and understand that it's going to take time to get those answers. And we just need to trust when they say there's no broadband and they also don't have running water. So we're going to mail leaflets with a lot of hand sanitizer. Do it.
Who do you look to for reliable information? I mean, aside from the public health TikTok that you're going to start, who do you look to for reliable information?
Right now, the CDC, although there are some aspects where we know that they're being censored in certain ways, the CDC is presenting really good scientific-based information specifically related to prevention and treatment of COVID-19. It is a really great resource to go to. It's where you're going to find the most scientific, up-to-date information. There are also organizations like mine that are tribal public health authorities or public health authorities. So excuse the ringing. I apologize for that.
No worries.
It's probably my man child trying to reach me.
Inquiring about the new TikTok channel.
Angry message right now. But if we look at local public health departments, like King County Public Health put on an incredible campaign. Washington State Public Health Department did. What I would tell folks to do is really look and make sure that you're getting it from public health officials. Don't, you can even, like I always tell my kid, look even for like the .org is helpful as compared to a website that is a .com. Make sure that you're just not getting it without being able to find the scientific basis. So any kind of information down at the bottom should have a citation. And that means you can go to that scientific information and verify what it is and where it came from. And just watch for misinformation. And I'm sure your cousin's grandma's, baby's, mama's dad, probably not the reliable resource unless they're directing a public health department.
Wait, Uncle Joe was wrong? No, just
You're telling me my Uncle Marty, who was an electrician, is not the right person to listen to about this? Interesting.
Your Uncle Marty keeps coming up in these conversations. I love it. It's
Uncle Marty's a real person. Yeah.
Before we move on to the next thing, there's a couple of questions that have come in through, people have texted in some questions. So if you wouldn't mind, I just to kind of fire a couple here. One of them was, and Abigail, you've kind of been definitely talking about this, but I was wondering if there's something kind of a little bit specific. Said lots of focus here on bad situations. What about highlighting good things that have been working? Is there something specific that you think like, oh, this has been really working great that you would like to highlight?
Yeah, and again, the work that I've been doing has been very specifically with the American Indian and Alaska Native communities nationwide, and we saw incredible people step in. So, for example, the Chief Seattle Club, and I will just caveat that is my sister is the executive director, but it's a small community. So, the Chief Seattle Club, when they first recognized, and they serve homeless American Indians and Alaska Native folks. They have about 900 folks a month who come through and are members at the Chief Seattle Club. They were like, where do we get a hand washing station for homeless folks? And so they went to a party store and rented a hand washing station that they put outside of the Chief Seattle Club. What we have seen is incredible innovation from communities of color and other communities who have used their local knowledge and resources to get what we need. My sister shared this incredible story with me of a homeless family, have young children, and they're currently homeless in Seattle, how they told her that they were boiling water over their fire at night to make sure that their kids and them could wash their hands, to make sure they are following those safety protocols. So that organization is getting that messaging out. We've also seen a recent investment here in King County. There's some other states such as California, a few others who are looking at the homeless populations, since I brought up the homeless population, and is working to get them supportive permanent housing, because we know they are less likely to transmit COVID-19 if they're in housing, not just something to quarantine them once they have been exposed or have COVID-19, but we're talking about permanent solutions. So the city of Seattle just funded and was part of funding the Chief Seattle Club to build 125 units of supported housing in Lake City. And so we're seeing these incredible investments, again, based on public health information that says when you house people, you are able to eliminate a lot of things. And then we're seeing like the messaging that we've worked with the community on, reaching the community, and even those who are most marginalized. I like go to sleep and I can see them in my dreams, this family boiling water over a fire on the side of the road so their children can wash their hands. That is incredible. That is the strength of the community in which we live, work, breathe, and are part of here in Seattle and in Washington. And that is an incredible blessing. I learn from them and I gain inspiration from them every single day. And there are examples like that in every single community nationwide. And thank you to whoever asked that question, because we need to highlight those. That is what's going to stop the spread of this pandemic. Right. That is what's going to turn the hearts of folks. That is what's going to get our justice seekers to stay on the streets demanding justice. That is what's going to change this community and go and build a new normal that is based in equitable access for all.
That's great. Thank you for that. That was it. Actually, you kind of answered another question that had to do with people that are unhoused. So I will skip that one because you kind of answered it there. Go ahead, Jenny.
Yeah, we got this. This feels like a pretty big question from Sophia on Facebook. She wants to know what inspires you to keep fighting for social justice for Indigenous people, for people of color within the public health field, when every day it feels like there's a new battle to face.
Yeah, that's a really good question. I feel like I've worked more since mid-January than I've ever worked in my life. And with that comes in sacrifices that I'm so grateful to my family for letting me, everybody else who's been at home, we've been in our clinic. And it's hard. It's hard. And I feel for all the public health professionals across the nation who are experiencing the same thing that I am. And I would say that we're not often seen in the same way as providers in a clinic. Like folks don't know the background work that we do. And the public health professionals across the United States are doing such integral work just like our providers are doing. And it is hard. It is a battle every single day. I wake up and get ready for the next one. And I'm really fortunate as an Indigenous woman that I follow in the footsteps of so many who came before me. I can name them off: my grandmas, my aunties, my uncles, and I have an incredible group of staff here at the Seattle Indian Health Board that every single day makes sacrifices for the health and well-being of urban Indian people nationwide. They're my inspiration. And because I follow in the footsteps of those ancestors who came before me, who were public health practitioners, who survived so that I could thrive in an environment that is still continually trying to kill me. And it is them and it is their prayers and their songs that I look to. I have this little note on a file cabinet over here that I keep it kind of eyelined. So anytime I turn in a chair, it's right there. It's an old crumpled up Post-it note. And on it, it says, I sing songs for your children's children. So as Native people, we pass knowledge through songs, through prayers, through traditions like that. And I'm always looking towards singing songs for your children's children, so that in 2 generations from now, a pandemic like this doesn't happen to them. Mm-hmm. What are the changes we need to do? What are the footsteps that those next generations will walk? And how can we continue to support each other to ensure folks like myself and other folks across the nation don't burn out in this and are able to get the resources we need to do the job that we are devoting our very lives to.
Good Lord, your words are music to my ears right now. It's just, if anybody is feeling down, they should just fire this interview up and listen to some of your words, Abigail.
Mm-hmm. And what you just said got me thinking about this notion that I feel like I keep seeing come up again and again and again, which is the notion of resilience, right? The definition of which is to be able to quickly recover from difficulty. And in February, resilience made sense to me. Maybe in March, resilience made sense to me, but we're now almost in September. We are seeing, as you have described these folks, justice seekers continuing to go out in the streets during a pandemic to keep this issue at the forefront of needing to deal with systemic racism. We have a pandemic that has no sign of slowing down. So I guess I'm wondering, is resilience the move here? Is the idea that we need to quickly recover from all of this? Is that the goal? I'm not sure anymore.
Yeah, I mean, that's a really great question, one that I've been thinking about a lot. So as Indigenous people, and we say it ourselves a lot, we are a resilient people. So if I think of my tribal background, I'm enrolled in the citizen of the Pawnee Nation of Oklahoma. And I say of Oklahoma because my people were from Nebraska and Kansas before we were removed by the federal government and put into Oklahoma. But on my father's side, in about 1830, there was an estimated 40,000 Pawnee people. By the census of 1910, there were 637 of us left alive on the Pawnee Reservation. So more than 92% of our population had died within 100 years. And pandemics, along with other types of genocide against Indigenous peoples, was a large part of that. And so I think about myself as a resilient person because I am a tangible manifestation of my ancestors' resiliency to survive so that I could thrive in the future. However, what we do and what I'm seeing happen right now, kind of being thrown at people, is like, you're expected to be resilient. And they've done that to Native people. It's like, oh, as Native people and other people of color, oh, we can keep doing these terrible things to you because you'll be resilient. And that is not the definition of resiliency that I use at all. So the definition that you just offered is in the Webster's Dictionary, and it's a noun, it's a thing. It's like, oh, you're resilient. It's like, no, it's not about an innate characteristic. So how I define resiliency is as action, because I go back to what my ancestors did to survive so that I could thrive. And they took action in many ways. Some of it was, the stories that I hear of my ancestors who, we weren't allowed to speak our language or sing our songs or tell our stories, all of the things that make us cultural Native people. And so they whispered them, they wrote them, they put them into art. They did whatever they could to resist the current oppression in order for me to be here thriving today. So resiliency, and in this, we have to think about it as action. So it's not about a quick turnaround, because as Native people, we've had more than 500 years of having to be resilient. It's not about like a quick turnaround and automatically bouncing back. It's about what actions can you take right now to be resilient in the situation you're in, regardless of race and ethnicity. Can you wear a mask? That is an act of resiliency for you, for your protection, for your family's protection, for your community's protection. Can you stay at home and only try to go to the grocery store? That's an act of resiliency. Can you make your really great online therapy appointments with your nice, good sliding fee therapist who make sure, to get your mental health and well-being done via Zoom? That's an act of resiliency. So I would encourage people to look at those everyday actions that you often disregard, because when people say resiliency, you're like, it's supposed to be this big, huge action,
Right.
and it's not that. It is those little steps. It is those actions that are continuous and build upon each other, that build the resiliency of not only you as an individual, but as the community. And that's the kind of community we want to live in. That's the kind of community we want to be. And that in itself, as you think about resiliency, and I think about those justice seekers on the streets, that's what they're doing and is necessary to break down these systems of oppression and of ongoing institutional structural racism that exist. We need those everyday actions by individuals to build this broader, beautiful community that we want to live in.
I love that idea. I love that idea of asking yourself every day, what is the action I can take?
Yep, active resiliency.
Yeah.
And sometimes in the hard times, sometimes it's just that little thing.
Yeah.
And it's also one of the things that we know that's happening across the nation is that we have seen a rise in people's mental health not being as good as it had been in the past. We've seen increases even here locally of domestic violence and other kinds of types of abuse. And we know that it's being exacerbated by this, the mental impacts of COVID-19 and a pandemic. They're huge and they're pressing. And I would encourage every person, whether they're a child, if they're a child who can cognitively understand the stress of their parents, if you are an older adult who thinks you might be more at risk, if you're the person who's in charge of going to the grocery store, you are having a mental health impact of COVID-19. And I encourage everybody to reach out to whatever their support systems are, to whatever their healthy coping mechanisms are. And there are a lot available at local community health centers and hospital systems, wherever you need to go, because as we go through this pandemic, we're in it for a while. We don't see a vaccine on the horizon for at least 12 months. We have to find those ways to have those everyday acts of resiliency, because you also can't take care of others if you yourself are not healthy and whole. So make sure that you're prioritizing that self-care. And I know it's hard. I'm the worst at it.
I need to take some of that advice as well. I know that. So we have just a few more minutes left here, and I do want to ask you a couple more questions. Let's start with the first one here. We're always looking for feedback, just as an organization, on what we're doing, the information we're putting out there. So I guess, what would you like to see from media in general, and specifically from KUOW, when it comes to really everything we've been talking about today?
Yeah, and one of the things that we need media to do is, to begin with, we need more representation of people of color and of different backgrounds within media, because it is then people can know and understand and be able to dive into the communities in which they're from to ensure that there's proper representation. And we know across media that there isn't proper representation of people of color across, whether it be print, TV, film, whatever it is. The other is that one of the things you find with media is that it often concentrates on the deficits. You want to tell a bad story. So I love that question before, where somebody asked, well, what are the good things?
Right.
And so one of the things I do here at my organization is I don't put out any data that is just deficit based. We always put out information that shows the strength and the resiliencies of the community, because particularly when we look at stories from the media that are about people of color, you only talk about our deficits. And I'm saying you in the larger sense, no accusations. But it builds the narrative that exists of people of color as less than, as not as intelligent as. All of the isms that exist are built in stories that are only built on a negative narrative. And so while the gaps are important, the deficits are important, the tragedies are important, alongside that comes the strengths, comes the everyday actions of resiliency that also have to be covered. So representation and change the narrative.
I love that.
Yeah.
Well, let's go ahead and hey, Stella, how you doing?
Yeah, there's my 8-year-old.
Hello.
I love that.
Really just seamless working from home. Just a seamless thing here. Yep.
So let's kind of end with this, and I want Jeannie, I want your input on this as well. Abigail, what has something that really made you laugh this past week?
Well, I have an incredible, hilarious staff, and they are continuously making me laugh. We laugh about everything that happens. So if anybody follows us on UIHI on our Facebook, so Urban Indian Health Institute on Facebook, I do this ridiculous thing because it's funny to me, where I put a cardboard box on my head and I put out a little square, and we call it UIHI TV. And I deliver some public health messaging out of UIHI TV. And sometimes, because I'm wearing a box on my head and I'm making my staff participate, we're laughing so hard that we can't speak. So there's one up on our Facebook that's me talking about social distance surveying and getting information from folks about COVID-19 from a proper distance. So the humor of our community is what makes us strong. We have to laugh.
Yeah, that's brilliant. Jeannie, how about you? What's something that made you laugh this past week? And you've been on vacation, so I'm hoping there was a lot of stuff to choose from.
I mean, right now I'm laughing that out of the corner of my eye, I can see my child, who is currently in her her elf pajamas at 2:00 in the afternoon, just sort of wandering in and out of the frame. That's making me laugh.
That's awesome. I will say, I've been I'm a big fan of stupid comedy shows. That's just kind of been my go-to to just make me relax at night. So there's a show called Ted Lasso that I just kind of been obsessed with. It just started on Apple TV, and it's about an American football coach that goes to coach a Premier League soccer team in England, and he knows nothing about the culture or even the sport or anything like that. And it's just really stupid fun. and he's just like the kindest hearted person in the world. And I'm like, oh, I want to be Ted Lasso right now.
Oh, I love that.
Yeah.
Oh, okay. Well, I feel like we could spend another hour talking about like things that are making us laugh. Just pull a resource document together of like, how can you find humor right now? But we have to wrap this up. Abigail Echohawk, this was a really wonderful hour. Thank you for spending an entire hour with us today. We really appreciate it. It's been great talking with you.
It's been great. Thanks for having me. It's a lot of fun.
And also, thank you everybody who's watching. Thank you for your questions. Really good questions today. And you can find this episode and all of the archived episodes of Are We Going to Be Okay on KUOW's YouTube channel. The best way to keep up with news about this show and everything else happening at KUOW is to follow us on Twitter at KUOW Engage, and to read our newsletter, you can sign up at kuow.org/engage. And if folks want to follow you out in the internet, Abigail, where should they look?
Sure, absolutely. They can follow me on Twitter and Instagram at Echohawk, ECHOHAWK, 2 words, Echohawk D3. And then also on Facebook under my name, Abigail Echohawk, and then the work of my organization under the Urban Indian Health Institute. And we share a lot of information on how and what we can all do in the midst of this pandemic.
Great,
That's
thank
awesome.
you.
And you can also email us your thoughts. For everybody who's watching right now in today's episode or any past episodes, just email us at engage@kuow.org. You can, like Jean said, you can tweet us at KUOW Engage. Thanks everybody who tuned in. Abigail, thanks for this amazing hour that you have spent with us. Next week it's going to be just next week will be 1 week away from the start of school. So, hey, we're going to be talking about education. That's right. We're going to explore how students and teachers are thinking about this next school year. And you're going to see me and Jeannie talk about how we're going to tear our hair out as parents.
You can watch sweat just pour down our foreheads as we have this discussion. It's going to be great.
Exactly. That's something for you to look forward to. And hey, if you like this show and you want to support us, please just subscribe to this YouTube channel. Our producer is Zaytun Ahmed. Our events team is Charlotte Duran and Bridget Anderson. Our graphics designer and tech guru is Tio Popescu. And you know what? Actually, Tio told me that I should use her actual title, which I have not been using, and that is design lead. So there you go, Tio. And our marketing manager is Michaela Giannotti. Our social media strategist is Juan Pablo Chiquiza. From all of us at KUOW, please be kind to each other and have a wonderful day.